Hey guys, welcome back to another edition of Simply Fit. I'm your host, Sandy White, and I am super pumped. We've got Dr. Troy Lynn Moy on today, and she's going to be talking to you guys about Chinese medicine. It's an alternative that you can take to get yourself, better acquainted with your health and wellness if you are not doing anything or doing something, but you're not getting those results. So we want you guys to jump back into fitness, and we want you to maintain your health and wellness. We want you to meet all of your goals. We want you to exceed all of your goals. And one of the things for this year, I told you guys that we're going hard, meaning I don't want you guys having any excuses. So this is why Dr. Moy is on, talk to you guys about an alternative way to keep yourself healthy. And then WYTV7 allowed us to do 30-minute segments with you guys. So go to the website, sign up for your free 30-minute health and wellness consultations so we can get you guys a game plan to get you moving one step at a time, but then being consistent again so that you can meet all of your health and wellness goals, maintain them, as well as exceeding them. And while you're on the website, check out all the wonderful things that we're doing in the community, guys. We're rocking and rolling here, and we don't want to leave anybody behind. So with that being said, since we only have a 30-minute segment, let's get Dr. Moy on the show. Welcome to the show, Dr. Moy. How are you?
I'm doing great. Excited to be here. Thank you for having me on.
I appreciate it. I didn't get a chance to tell them, but you've got over 30 years of experience in alternative medicine, and you really specialize with the areas of stress and anxiety and immunity and sleep. Now, one of the things I also like is because we're on a mission to help 1 million individuals through health and wellness to overcome suicide and depression. And we do that with simple tips and strategies. And so not all of the individuals are going to resonate with me, and this is why I like to have individuals to come on, not so like you're so far from me, but you're, again, I love the word alternative. But what about why is Chinese medicine considered an alternative? Because it kind of sounds like holistic medicine, but I may be off, so correct me.
Okay, thank you that's a great question. So, in the Western world, the standard of care is the allopathic or the Western model, which a lot of people call it a sick model, a broken and fixed model. And so when you have that, anything else is considered alternative, the alternative to the status quo, right? And it really, what we're looking at is this model of, health where you just like give a bunch of drugs, we eat, poor diet, we have poor diet, exercise, like kids don't exercise enough. I mean, there are a lot of things that are really missing in terms of empowering the person to take care of themselves. So why is it called alternative? Because it's not a Western model. So anything that isn't fitting within that, pharmaceutical driven model is considered alternative. So, looking at how you're eating is considered alternative versus if you go to a dietitian, which is more medical. So anything in a broad sense that you do for yourself to take care of yourself, it can be really considered alternative to, going to a Western or a doctor to get a pill to fix your, to heal yourself, right? So that would be, why is it alternative? Right. But
Okay.
now it's really like a holistic medicine is is considered alternative to that Western model, and also integrative medicine. We're looking at more of kind of combining the two different paradigms, or at least trying to have bridge those things.
Okay. So let's move on where, because one of the things I did not share, you now I don't know if this is a specialty because I know you have a book, and it's Will I Ever Get Pregnant? The Smart Woman's Guide to getting pregnant naturally over 40. And I know a lot of women are waiting till they, climb the corporate ladder and travel and all of these wonderful things, before they have all these little people. But one of the things that when you wait, your body starts to change and it starts to mess up your lady parts. And part of that is due to stress. So what areas, in the fertility area, along with what we just discussed, doing alternative medicine, can women do? Now I know, guys, some of y'all, and like, I don't want kids after 40, whatever, but there are some people on here that want children. And one of the things, if you don't mind, Dr. Moy hit on, a lot of women get fibroids. I don't even know because they don't have a really pinpoint, and I know I had them. And my youngest is 10, and one of the ones, they were able to get them all out before I had my first child. And then when I had the second one, who's 10 now, they couldn't get the other one out because they said, oh, it was too little. But as he was growing, that fibroid was growing. And reason I asked you that, because one, I'm being selfish, but I know a lot of people are in the same position I am. The first thing that they say, Western medicine, is, oh, let's cut it out. And I'm like, why do you have to cut my lady parts out? I know there's got to be something else that I can do. And when I said that to the doctor, she actually got offended. There's nothing that you can do, eating right, da-da-da. I'm like, no. So help me out, and all of the other ladies is on here that don't want their lady parts cut out.
Okay, that's a great, well, there are other aspects too, which are, how you're being treated according to what you're, if you're a person of color, which I'll bring it up, that there are different standards of how people are being treated in medicine, right? And what I can say is when a physician, no matter what physician, right, we also have it in the holistic space as well. If they're not listening to you and including you in the decision-making process, then you need to change your doctor. That would be the first thing. If they're, if they're not, if it's this idea, we'll just like cut it out, surgery, you don't need, your lady parts, let's put it, that you were born with them for a reason, and they do serve a purpose. And it's really like an old way of thinking about health, in particular for women. And I don't know if I talked about this with Dr. Betsy, but the Western model of medicine still treats women like it's the 19th century. Their problem is their hormones. Their problem is their uterus. They've got hysteria. So instead of, placing women in a, a mental institution, they tend to just give them a lot of mood stabilizers, or put you on birth control, or, the next thing is, well, we'll just take your uterus out. This is such an old way of thinking, and not understanding that, hormones are part of your entire system, and stress plays a huge role in things like fibroids, right? Because it develop, and we're looking environmentally too at all of the plastics, the chemicals in our food, the stress levels, all of those things. And you see that, certain segments of the population where they have, let's say, food deserts, where the nutrition is lacking, access to food, et cetera, lots of we call more products, like eating a product, not really a food. The more it's processed, it's more like a product, right? That you start to see the chemicals, and those are acting on the body. Big issue is stress. Women in stress, it's not good. The more stressed out, you find it is really affecting the menstrual cycle, right? The whole reproductive cycle, because hormones. So that's just one aspect, right? And then you take the emotional component as well. So getting back to fertility, let's say fertility, I always look at it as a symptom of overall health, right? So if a woman is having difficulty with conception, that's the symptom. It's the symptom that there's something out of balance. And it could be, from a long time ago. You see a lot of it. It's all connected, right? So really, like the holistic model is we're going to look at everything. We're look at the relationship of the home. Where are they living? What kind of stress levels are they having? What's the diet like? Are they exercising? Are they happy? Right? Like though all of those things are going to make a huge difference in terms of reproduction, right?
Yeah,
Um,
I agree. Because when we were trying to, because actually, and my household is backwards. My husband, he's not a girl, but he was acting like a girl. He was so pressed. I want babies. I want babies. And I'm like, dude, I don't want any right now. You know, we got a lot going on. And a lot of times we don't look at that. I mean, because you're being mommy, you're being whatever the hats that you're wearing. And we were in theology school, regular jobs, doing all this volunteer work. And like you said, the stress. And I didn't realize that. And we were trying. I mean, you know, going, I'm taking the shots. And I was like, you know what? I'm not taking another shot. And the moment, it just seems like the moment I said, you know what? Forget everything. We're just not having no babies. And then I just went, I ended up pregnant, but I didn't even know it, you know, because I had relaxed so much. But that's a good thing that you know, you're telling folks relax. So what are some tips that you can share to tell people that, you know, hey, you're stressed? And because I didn't really realize that I was stressed, I thought, you know, this is normal, but I was stressing my internal body out, my internal organs out. And they, like you said, it was a symptom and it wasn't working.
it was interrupting the path. So when you're stressed out, and most of the people, what I can say is most people don't recognize that they have stress. They usually think of it as an event. I was stressed out about, or something really big, that this thing stressed me out. But daily, the low levels of the adrenaline and the cortisol, what they do is they affect your ability to get a deep sleep. And you find that a lot of people who are stressed, they have stress, their mind is very active. They can't fall asleep, or they fall asleep and they wake up. And so over time, what that does is it wears on the body. And so that is a stress on the body. We always think of it like an emotional, but the fact is if you're not getting the right nutrients, then you're going to be taxing the body to come up with the energy, right? So these are, and also weight, being like overweight, or having, we consider overweight also malnutrition, because it's not natural for the body to be overweight, right? It's not efficient. So we look at efficiency. We live in controlled environment, right? We don't need to pack on 20 pounds of fat, to be warm for the winter. So we really don't need any more. We don't really need any more. And so the more weight we have, it's actually more energy to do activities and move. So if we're looking at something metabolically is not right for you to be carrying all of this weight around, right? So when we start to look at it, that there's something else that's going on, right?
I love the fact that you just mentioned to folks it's not natural to have the excess weight on. I mean, because it causes a lot of challenges, from, you know, the wear and tear on your knees, you know, like you said, the sleep. One of the things that you mentioned in your book is libido. A lot of people think, oh, I'm getting older and this is why, you know, I don't want to be intimate, you know, anymore. But that has nothing to do with that. That's a symptom, and people don't realize when you get symptoms, that's your body telling you to correct something. So I love that. Well, we're going to take a quick commercial break, and then we're going to be right back with Dr. Moy with more tips that help you guys understand and implement Chinese medicine.
80% of women will develop a pelvic health condition at some point in their lives. There is relief. There is hope. The Pelvic Floor Store, your resource for personal health.
Hey guys, we're back with Dr. Moy, and I hope you guys enjoyed the commercial break. But we talked a little bit before our break about how individuals of color are treated in the medical community. So I want her to touch on that a little bit more, because when you're having hormonal or I'm getting tongue tied, lady part challenges, you need to be educated and you need to have the right doctors that are helping you. So Dr. Moy, touch on that a little bit more.
Okay. This is okay. So the medical system, and especially also in mental health, right, is really geared towards a model that is a white middle class male, right? With most of, let's say, psychology and medical school, they are teaching students based on the physiology and signs and symptoms of people who are primarily white. And much of the education when treating patients or people of color, or let's say non-Hispanic or non-Latino white, is based on a lot of racist ideas. And so this it's kind of endemic, because they make assumptions about people's health based on race. And so we see this a lot in fertility and maternity. There's such a high rate of infant mortality and maternal mortality in populations of color. And a lot of things are missed or ignored when they shouldn't be. And like what you had touched upon earlier about things like fibroids are, we see them a lot in people of color. We see a lot. And I also have a theory about that this is a part of this oppression that shows up, and you see it generational generational stressors that then are kind of like sitting there, and they turn into these pockets of what do you call, like with the fibroids are, they're considered like a kind of energy that needs to be released. Trauma, let's say, we'll call it generational trauma. I'm sure the medical community would come after me for that.
Yeah.
But you kind of inherit certain things, right? And in particular, you were in your mom's belly, and your mom was in your grandmother's belly. Like, so you were actually kind of developing, it's 2 generations back, if we look at it like embryologically. And so whatever your grandmother was experiencing at that time was kind of translating into your mom, and then part of it to you. And it's, so this is what we're looking at. I don't know if you could call it epigenetics. There is something known as the morphogenetic field, which is something, that kind of misty substance that is like genetic outcome, but could turn something on, turn it off, right? And so if your mom was stressed when she was pregnant, or your grandmother was stressed, that some of that definitely comes through. I mean, research may say that's not true, but I believe that we're more than our physical bodies. We are more than just biology and hormones. We've got energetic fields as well.
Yeah,
Right?
we are energy, and I agree with you, because like I was talking to a on the interview yesterday with the young lady, that it's contagious. It's like, if I'm yawning or I'm laughing, eventually you're gonna start mimicking whatever I'm doing. So I totally get what you're sharing. Let me ask you this: is have you treated someone that had fibroids with acupuncture?
Yes.
So,
So very important with fibroids and any so if we're looking at like the hormonal aspect of it, is that we need to address the stress. And one of the things that acupuncture does, and this is research by NIH, is that it helps the body to release neuropeptides that say rest, relax, and relieve inflammation. So if somebody is stressed, they need to be able to go from that adrenaline, cortisol, and then, kind of go down into rest and digest. If they're constant low level stress, which means, oh my gosh, my phone just, buzzed, I have a message, or, those are all those little spikes of stress hormone. So then you have like low amounts, but constant. And so then the body doesn't actually go through the wave. You need to have like the yin and the yang balance, right? We're always in a state of dynamic balance, right? We're always kind of like moving, awake, sleep, like all of those aspects of our health. And so being able to help the body get to that place, then it helps to reset, right? So and so once you're able to balance, then you can heal, right? Most people like heal about, no, you have to do some balancing and then the body clicks in to heal, right? So that you're not producing these surges of stress hormones that affect the pituitary, the thyroid, the hypothalamus, like all of those in the ovaries, right? So that's one aspect of it. And then there are also, we have to look at like the diet, like what other things also, chemicals in hair products and soaps and all of those things that are in our environment, whatever we can get rid of, like plastics, synthetics, and then also looking at food, having foods that are going to be more whole, right? Whole is better than processed. And I almost think like whole is better than, and even like organic processed. Once you get into processing, you're already transforming, is not necessarily food for your body to absorb. So there are many different, I also look at the gut as well, because
Gut health, yes.
that's a huge mitigator of manufacturing or for your immune system, for your serotonin, right? Because earlier you had mentioned things like depression, and so we start to look at if you're not getting sleep, then you're also not making serotonin, right? Like, so there are all of these, everything is really connected.
Right.
So those are important things. Those are like the things I mentioned are really about basic health balancing. And then we might do some herbs, right? Some herbs to kind of help facilitate, with the fibroids.
Okay. So
Yeah, and
let me
exercises, right? Stress relief exercises.
Absolutely. I just went and got me. Unfortunately, I'm addicted to exercising, and I just went and got a total gym because I'm like I am going hard because one of the things that I keep saying I really want to get back into the wellness competition. My husband is a little skittish about me doing it, but I'm like, you got to go big with these dreams that freak you out so you can be healthy all over. And it's not, and I always tell people being fit is more than just exercise. So, if you're challenged with your fertility area, your mental stability, you're not getting enough sleep, you got to go get some help. You can't be afraid of this. It shouldn't be taboo. But let me ask you this now. This is not off the beaten path, but like sinuses, IBS. You talked about digestion because you said you check with the gut health, but and IBS is pretty much going to be connected with the digestion. But what about like how would you handle sinuses?
Okay, so just see, sinuses are also mucous membrane, right? So if somebody has like food intolerances, like for instance dairy, like something like 70% of the world is lactose intolerant. So oftentimes if you're having a digestive problem, that you're also going to have a problem in your sinuses. And then also for women, it's going to affect their vaginal flora. And so we're really like looking at the whole system. So with sinus, we really want to look at increasing the circulation. I might do points there, but also the immune system is been triggered, right? So a runny nose is usually it's a response to something that is coming in. It's like an immune response. The mucus comes out to trap the germs. But if someone has like allergies all the time, then we're looking at, the immune system is being triggered. So either there's something in their diet, environment, or we're also looking at, dust is not going to kill you, right? So then it's an over response to a stimulation, right? And so then we need, again, the looking at the stress levels and then and the histamine, right? Because that's also will cause a response, right? Some people get stressed and they break out in a rash,
Yeah.
right? So their response is going to, or anxiety, they get worried, they get these big blotches on their body, or eczema and things like that. So we're looking at overall inflammation, and then how does it manifest? If you have inflammation, then already, then just another thing is going to set off your sinuses, right? So usually that's just like the external, your sign. You're like, oh, maybe there's something else going on, right?
Yeah. Guys, Dr. Moy has been giving you guys a lot of tips and suggestions on what you can do. And the bottom line is your body gives you warning signals. So take these warning signals and go get some help. Stop putting band-aids on it. Now, correct me, but I'm looking at Chinese medicine as getting to the root cause, and there's always a time and place for Western medicine, but sometimes it's like much too much and it comes with a lot of side effects. So since we're down to the last 5 minutes, if you want to address that, you can, but what I really want you to do is let people know how they can reach you, because I know from your website you are seeing folks, and she is going with the CDC guidelines, so you gotta wear your mask. But are you doing virtual, or how are you doing it? Let people know how they can reach you.
Okay. I can be reached on my Instagram, or also on my website is pretty, just shoot me an email. Now regarding like herbs and, you were asking, do herbs have side effects, or you were asking?
I know it just sounds like Chinese medicine just gets to the root cause of whatever the challenge is, where Western medicine is, like we mentioned before, cut it out, swipe it out, whatever, whatever. And sometimes it's just too much, and then it comes with side effects. So, not downing Western medicine, but just like quickly letting folks know what's the best way to introduce themselves to Chinese medicine.
Okay, so really, Chinese medicine is very personalized, and there are ranges. One to be like real formulation for very specific conditions and patterns. So you wouldn't use Chinese medicine like you would use like vitamins. It's really like looking at supporting the body to do what it does best, to bring it into balance, and then it will self-regulate. So in Chinese medicine, there's also like food therapy, or you call like medicinal food, like certain soups and things. Classic is actually miso soup. It's like in a book called like Emergency Remedies to Keep Up Your Sleeve, which is like 500 BC. And really, so the idea is like there, first you would want to see what you could do food wise, medicinal food, like chicken soup, things that have like onions and garlic actually help to the sinuses. And then, but if someone has like chronic rhinosinusitis, then we're looking at, oh, maybe there's something else. And we really need to look at the pattern of the person. So if they have underlying, let's say sugar intolerance or diet, if they have another kind of a disease, we need to look at, okay, they have that and this other thing. How do the two patterns intersect, right? And they are going to be related in some method, in some way. Western medicine is really great for life saving, right? It's going to save your life. But it's not meant to necessarily make the quality of your life optimal. Like you have to do that, right? Like you can take a pill, you can get surgery, you can take a pill to lose weight, right? But are you still going to be healthy? That's very different than, as you know, if you're working out, you're getting stronger, you're feeling better, right? You are healthier, and therefore you're younger. You're reversing aging. Right?
Right.
Uh, so this is so there is a time and a place to use things. Really need to go, if you take a lot of medication and you want to begin to use something in with Chinese medicine, like herbs, acupuncture is very safe. With herbs, you really need to go and work with somebody who would understand if there are interactions. I would also suggest that you have a conversation with your physician about, hey, can I get off some of the, like, you want a path to reducing or getting off of a medication if it's possible, right? oftentimes the Western model is here's the pill and you take it for life. In Chinese medicine is you're going to take this till you get to this point, and then maybe we're going to shift it. And then the healthier you get, including exercise, diet, what you're thinking, right? You have to manage your thoughts, the people you're around too, like all of the things to help cultivate your health. And you work together, right? This is like, like health coaches are actually probably kind of a modern version, like they're all different pieces, but really they coach you to make better changes, right? Make informed decisions.
Right. I appreciate that. Guys, we have had an outstanding time with Dr. Moy. You can go to her website, integrativehealingarts.com, and you can also pick up her book if you're interested in having babies naturally and you're over 40. And then the title is Will I Ever Get Pregnant? The Smart Woman's Guide to Get Pregnant Naturally Over 40. Dr. Moy, thank you for being on the show. Guys, I'm Sandy White, the host of Simply Fit, your #1 health and wellness cheerleader. We broadcast every Wednesday night out of Upper Marlboro, Maryland at 7 p.m. Eastern Standard Time. So make sure you check your time zone. And once again, thank you, Dr. Moy. And anytime you want to come back on the show, we appreciate it.
I will. And you know what? I actually just wrote something. The Chinese Zodiac is coming up, the new year. And what I'll do is I'll send you a link for your listeners if they're interested in the Chinese Zodiac, which is a branch of Chinese medicine, astrology. And I've made predictions for the different zodiacs. So Zodiac health. We could always talk about that too sometime.
All right. Hey, anything for alternative, because everybody doesn't like, it's people, we want alternatives for people to choose so they can be healthy, they can be consistent. Again, as I told them, we want them to meet their goals, exceed their goals, and maintain their goals. So again, thank you for coming on. Bring all of the alternatives for our folks, and we appreciate you.
Thank you.